Hello, my name is Patty, and for this project, I chose the country France. So, the culture of France regarding the view on addiction. France has one of the most strictest laws in Europe, as using any illicit drug could lead to 1 year of jail time and a fine of up to $4,450 US. And in 2020, France created on-the-spot fines of around $237 to those caught with small amounts of drug. And it's important to note that since the drug laws were passed on December 31st, 1970, the number of drug arrests in France has steadily increased to nearly 140,000 in 2016, or about 67.5% of all arrests. France notoriously has the harshest laws in Europe, yet they have the highest consumption rates of drugs. The result of the creation of the Wall of Shame, as shown in the image, it was a wall built to seal off a tunnel to a low-income suburb in northeast Paris. Because in northeast Paris, the cocaine market is out in the open and the consumption of the drug is increasingly visible in public spaces. This was a temporary measure that was built to protect the residents of the suburb from cocaine users and to move the cocaine users to somewhere where residents aren't around. There was also a comparison chart of a 20-year difference in the perception of the danger of different drugs from 1999 to 2018. But as you can see, the public generally still has the same perception as they did 20 years ago. Addictive habits, alcohol and smoking. So France is known as a wine-loving country partly due to the culture and history of winemaking. They have one of the highest alcohol consumption rates, with 58% of the alcohol they consume being wine. And from the image, you can see that France is the 5th country with the highest consumption rates in wine worldwide. The alcohol limit is 2 cups a day for females and 3 cups for men, but around 24% of adults in France surpass the limit, as it's normal to consume alcohol with your lunch or dinner. A fun fact was that wine used to be given out to children as young as 14 at the school cafeteria, but France stopped serving it in 1956, and in 1981 there was a total ban on it. Alcohol also leads to the second biggest cause of preventable deaths, as alcohol increases the risk of cancer, high blood pressure, and cardiovascular diseases, just to name a few, and all these conditions can lead to eventual death. France is also big on smoking. The French can attribute their high smoking rates to the government's lack of action towards tobacco, and due to cigarette marketing tactics, smoking became associated with national identity. The birth of cafe culture in the 1960s also contributed to the high smoking rates, where people were able to smoke inside places where they could eat. Out of a population of 67.75 million people, an estimated 13.2 million are adult smokers. There was a smoking rate of 24%, but there has been a decline in smoking by 35% for all age groups except for ages 15 to 19, as you can see in the image. Smoking is also the leading cause of preventable deaths in France, as it leads to cancer, heart disease, stroke, diabetes, and lung disease. So, addictive habits for other drugs. France had a heroin epidemic in the 1980s and 90s, but it was managed by France massively expanding access to the anti-addiction medication buprenorphine, which reduces withdrawal and cravings for people with an opioid addiction. They made it accessible so that any doctor could prescribe it without any special training or licensing. And this worked, as in just 4 years, overdose deaths from heroin declined by 79%. Now, cannabis is the most used illicit drug, with an estimated 5 million users in France. France actually has the highest cannabis usage in Europe, as you can see from the image, and it's important to note that cannabis and all drugs listed here are illegal in France. But cannabis has a favorable public opinion and is generally accepted by the public except by law due to its naturalness and not being synthetic. France has one of the highest cocaine usage rates in Europe and is the second most frequently used illicit drug, with 600,000 users per year, but is far below that of cannabis. However, the lifetime usage of cocaine has increased fourfold in 2 decades, from 1.2% in 1995 to 5.6% in 2014. Synthetic drugs such as MDMA and amphetamines are also used, not as frequently, but they also have the same issue of an increase in lifetime usage. And the usage of heroin seems very rare after the heroin epidemic. Risk factors. So there are many risk factors to increase your substance use. One is social connections, as it's normal that when you have people around you who use drugs, you'll probably also use a drug. This correlates with the WHO study that found out there was a decrease in alcohol consumption, cannabis use, and smoking in adolescents during the COVID-19 pandemic, which was a time when everything was restricted and locked down. This finding is most likely due to limited opportunities for meetings or festive moments with peers, which has led to fewer opportunities to use substances. And you can see in a chart how much French adolescents use drugs. Your family situation can also increase your risk of substance use. A study found that 44% of adolescents who live with non-intact families or dysfunctional families reported daily smoking, binge drinking, and regular cannabis use much more frequently than those living in intact families. Another risk factor is your socioeconomic status. Families with low socioeconomic status are usually more vulnerable due to unsafe living conditions, inadequate schools, and more stress. A study found that heavy use of substances is associated with lower family socioeconomic status. Your low socioeconomic status is also associated with education, as poor schooling or institution with poor school connectedness led to high drug usage among adolescents, and high frequency of drug use was also found in adolescents with parents with low education attainment. Possible connection between substance use disorder and illness. So cannabis is widely used in France by people who deal with emotional and or physiological difficulties instead of using psychotropic drugs. There is also a high percentage of medical cannabis use, and it differs among age groups that generally 52% of people among 50 years and over use cannabis for medical reasons compared to 80% of them use it for recreational purposes. This is the opposite of among 18 to 29 years old, as 18% use it for medical reasons and 50% use it for recreational purposes. The main reason for using medical cannabis was for pain management, and other reasons for using cannabis include feelings of hopelessness, being impulsive, a need to seek the feeling of sensation, to relieve anxiety, nervousness, depression, and to treat insomnia. Suggestions. So primary prevention involves interventions before the development of substance abuse. To prevent the development of substance abuse, we should increase the knowledge of the substances, talk about their effect and consequences, and then promote an anti-substance use attitude. Since most substance users are from low socioeconomic status areas, we should increase the funding and development of the schooling institutions to provide adolescents with the proper education that they deserve. The community should also come together against substance use, advocate, and implement programs on social welfare, health promotion, and education. Secondary prevention includes screening for substance abuse and early interventions. Primary doctors should implement the screening to identify individuals who have or are at risk for developing alcohol or any drug-related problems at each visit. And this will lead to the identification, diagnosis, and development of a treatment plan. The screening could ask questions on personality traits, family history, family issues, and accessibility of substance use in the community, just to name a few. This is extremely critical to identify the individuals who are at risk for early intervention. Tertiary prevention involves interventions to prevent the progression of established substance abuse before it has negative health consequences. Early intervention, pharmacological treatment, and rehab programs for substance abuse will be part of the tertiary prevention. These are my references, and thank you very much.